Okay, good morning, everybody, or to our East Coast friends, good afternoon to you. My name is Heather Romano, and I am the Managing Director of HR and Training with iVET360. This is our second COVID-19 Town Hall in our current April series of Town Hall meetings. Let's kind of jump right in here. So today we're going to be discussing a lot. This is going to have an awful lot of information. All of the slides and the recorded presentation are going to be available at the iVET360 COVID website. So I will have that link for you at the end of the presentation here. So you don't have to take notes. You'll be able to download all of the slides with all the information. So that'll free you up a little bit to pay more attention whenever you can. So today we're going to be starting with a brief review of the HR 6201 law. That is also known as the Families First Coronavirus Response Act. We talked a lot about this on the last call, but we have had a lot of clarifications come through from the government over the last week. So we'll give you all of those updates today. We're also going to give you current information on the payroll tax credits that are available. We have more information about how you can be applying those to your payroll. And then we are also going to be going over the employer-specific items in the CARES Act. The CARES Act is the one that was just passed by the Senate this last week. It is an enormous act, $2 trillion worth of financial impact on the economy. There's a lot of pieces to it. We can't cover all of it today, so we're just going to be focusing on the things that are most important to you as business owners and practice managers. And then finally, we're going to be having question and answer session with me. So we're going to be doing that a little bit differently today. Instead of a typical, here's a question and here's an answer to that question, we're going to be more rapid firing answers to more broad categories of questions. So using this method sprinkled throughout the presentation, we're going to be offering answers to nearly all of the most frequently asked questions that were sent through the registration process over the last couple of weeks. Now, if we don't get to the question you sent today, we're going to try to get to those other questions in one of the following webinars. In addition, we have Tamisha Kronik manning the questions feeds. You are welcome to ask questions as we go through the presentation, and Tamisha will answer as many of these as possible. Please ask questions in the questions tab of your control panel instead of raising your hand or using chat. We won't be able to see any questions that go in the chat or raise hands. Now, Tamisha will likely not be able to answer all of your questions today, but she's going to do her best. Also, I want to draw your attention to a couple of attachments that are here on this webinar under the Handouts tab on your webinar control panel. These include an FFCRA employee leave request form, a letter to your team explaining the current situation in your practice, and the FFCRA poster. The FFCRA poster is required to be hung where the rest of your employment posters are currently hung. You are welcome to download any of these forms if you feel that they would be helpful for you. So we'll start with a very brief overview of the FFCRA, HR 6201. This, as you probably know, was signed into law by President Trump on March 18th. It is a comprehensive bill aimed at softening the financial fallout of the coronavirus on families in the United States. Eligible employees are any who work for an employer with fewer than 500 employees. This means all animal hospitals. I don't think there are many hospitals in this country with more than 500 employees. If you are one of them, you are welcome to ask a question about how this law affects you. So what does this mean for the practice? To better understand it, we are going to be breaking this down into three parts. Part one is the emergency family leave. In this presentation, we are going to be referring to this as either expanded FMLA or EFMLA. Part two is the emergency paid sick leave. In this presentation, we're going to be referring to this as either emergency paid sick time, sick leave, or EPSL. And then part three are the tax credits for parts 1 and 2. Keep in mind this is going to be fairly high level, but we are going to be introducing some new information that we've received over the last week here. So we're going to start with the expanded FMLA. This applies to employees that have been employed at your practice for at least 30 days who can't do work or telework because their child's school or daycare service is closed due to the coronavirus crisis. Now, there are exemptions. This is one of the most common questions that we received is, well, how do I become exempt from this law? Exemptions are going to be based on these three criteria. Number one, the money that you spend on sick and expanded FMLA would exceed the amount of money you bring in revenues. So that means in a given week, if you bring in $20,000 of revenue, but if you include all of the money you spend on the sick leave and FMLA, you end up spending $30,000, then you can be exempted. If your revenues for the week are $20,000 and your money spent on the FMLA is only $15,000, then you would not be exempt. And that's something very important to remember. Number two, the absence of the employee would cause a substantial risk, and this has to be a provable risk to the financial health of the company, specifically because they have specialized skills, business knowledge, or responsibilities. For the most part, in veterinary hospitals, we do not have anybody that meets that criteria. Usually in a general practice hospital, we have several doctors who can provide medical care. If you only have one doctor who can provide a specific service like orthopedic surgery or emergency surgery, then that person could potentially be exempted if you could prove that it would damage the financial health of your company. And then finally, you can be exempt if there would not be enough other employees to perform the necessary basic labor needed to keep your practice doors open. As a result of these criteria, very few animal hospitals are going to apply or are going to be exempt from this law. Most of the time, it's going to be very, very small practices with 5 or less employees, and this will only apply to the 12-week child care aspect of things. So you cannot be exempt from the sick leave. Now, a little bit more about exemptions. If you decide that your practice is exempt or that certain employees are exempt, and this is declined by the Department of Labor or the IRS, your practice is going to have to pay back pay to those employees who actually did qualify for and took advantage of the expanded FMLA. So keep that in mind, that if you decline it now, you may have to make a very large lump sum payment to those team members in the future. Now, let's look at some common questions about the emergency family leave. Paid leave begins on April 1st, 2020. In the initial CARES Act, there was verbiage stating that it was going to be retroactive to March 1st. However, this was removed from the final version of the CARES Act. So this is not retroactive. It starts on April 1st. This means that anyone who took sick leave in March or February due to coronavirus does not need to get paid for that time. Now, the law technically states that the employee must show evidence that they have either tested positive for the virus or that their healthcare provider told them not to go to work. However, there's a problem with this. The medical system is currently extremely overloaded in most areas, and doctor offices are asking people not to contact them unless they are currently sick. They are refusing to hand out doctor notes right now. Most employees are also unable to get tested unless they are sick enough to be admitted to the hospital. So we are recommending that you as an employer act in good faith and assume that the employee is being honest when they say that they need to take time off, and tell the employees that they may need to provide retroactive documentation after the crisis is over. Now, the FFCRA does state that essential employees are exempt. However, this is defined as essential employees and not essential businesses. Essential businesses are businesses that are allowed to remain open during a stay-at-home or quarantine order because the business is considered necessary. So this is completely different than the FFCRA's definition of essential employees. Essential employees are, in general, people who are employed by a human healthcare facility or research institution. Veterinary practices are specifically not defined here, and veterinary employees are therefore not considered essential. This means that no veterinary employees are going to be considered essential and therefore exempt from the FFCRA. Now, You're going to want to remember that the only family members that an employee can stay home under the FMLA childcare leave are their own children. This is specifically written in the FFCRA. No grandchildren, nieces, nephews, etc. are covered by this act. So if you have somebody who says, I need to stay home to take care of my grandchild, you can decline leave to that individual. Also note that the FMLA is not in addition to a typical 12-week FMLA leave. It is concurrent. So this means that if an employee who is covered by FMLA, and that means businesses with more than 50 employees, so if you have less than 50 employees, you can tune this little piece out. If one of those employees already took 6 weeks of FMLA leave in the last rolling year, then they would only be entitled to 6 weeks of paid expanded family medical leave. Finally, Congress removed language that restricted the expanded family medical leave from intermittent use. So this means that you, as an employer, should assume that employees may take the FMLA intermittently. Now, this means that, let's say somebody has childcare that has closed and they have a co-parent at home. So the co-parent can take 3 days a week, but this individual needs 2 days a week off. They are allowed to do that under the expanded FMLA. This can actually be a huge benefit to your practice because if you've got 10 parents, instead of all those parents taking 12 weeks off all at once, they can take different days off, which can help you balance your team much better. So let's talk a little bit more about parents who have a co-parent in the home. The FMLA does not make any statement about situations in which both parents are home or working from home. So in theory, this means that you may be able to push back a little bit against somebody who is claiming they have to stay home and care for a child if you know beyond the shadow of a doubt that their co-parent is also home and is physically and mentally able to take care of that child. However, you really want to be cautious here. We really don't know the circumstances of any individual's home life. And there are going to be some situations in which we don't know that the other co-parent is unable to care for that child. So in general, we recommend just giving people the benefit of the doubt here. And then finally, do not offer childcare for your employees' children. We received some questions about this during the last webinar, and we've received questions about this since then. We actually received some guidance over this over the weekend. Childcare in nearly all states must be licensed by the state. So if you are providing childcare in your practice without a license, this can cause very big problems for you from both a regulatory aspect and a legal one if a child becomes injured or sick as a result of being at your practice or in your daycare arrangement. So for the safety of your practice and for the legal liability safety of your practice, don't offer childcare for your employees' children. Next question here. Is this paid? So yes, this is paid, but there are a couple of pieces to this. Number one, the first 10 days of expanded FMLA may be unpaid. However, employees can elect to substitute available PTO or sick leave that they have accrued already. After the initial 10-day period, employees are eligible for at least 2/3 of their regular rate of pay based on the number of hours they would otherwise have been scheduled to work. The paid expanded FMLA will cover eligible employees for a period of 12 weeks. All employees, regardless of how long they have worked for the employer, will be eligible for the paid sick leave. Now, this is the 80 hours of sick leave that is available for anybody who contracts COVID or needs to care for somebody who has contracted COVID-19. Part-time employees are entitled to paid sick leave based on the number of hours they work on average over a 2-week period. So you don't have to pay somebody who only works 20 hours a week 80 hours worth of sick leave. If they only work 20 hours a week, then the maximum that they can get is 40 hours of sick leave. The EPSL is in addition to any sick time that you already provide. So if you provide 5 days of sick time, that means that the individual can, in theory, take an additional full week of sick time to either recover from their own COVID infection or take care of somebody else who is infected. Now, there are a lot of qualifying reasons for leave. You are probably already well aware of these. We covered them in the last webinar, and they are pretty much on every piece of news about the FFCRA. So we'll just kind of breeze through these. Number one, the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. An example of this is in Portland, Oregon. If a hospital in Portland is currently operating, but a nearby town, Beaverton, for example, has stated that nobody is allowed to leave their homes except for essential employees. And again, essential employees are those who are working in human healthcare facilities. Then that practice would have to pay those individuals the 2 weeks of leave for not coming to the practice. Reason number two, the employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. Number three, the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. This is really important, again, because most of our employees are not going to be confirmed diagnosed COVID patients because of the fact that there is such a lack of testing and it is so difficult to get a test or even an appointment with a doctor right now. The other three are the employee is caring for an individual who is subject to either number one or number two above. So that means if a family member of theirs has contracted COVID-19, they can take time off to care for that individual. Number five, the employee is caring for their child due to COVID closures. Now, this means that technically, in addition to the 12 weeks of time that they get for expanded FMLA, they could, in addition, take the 2 weeks of paid sick leave to care for their child for the same purpose. And then finally, the employee is experiencing any other substantially similar condition specified by the Secretary of Health and Human Services. This is really difficult because they keep promising that they're going to come out with similar conditions, but they have not done this yet. So as of right now, this one does not count because there's no similar condition. We are taking it on the assumption that that means if somebody is exhibiting any symptoms of COVID-19, so any of the upper respiratory symptoms, any of the gastrointestinal symptoms, or a fever. So the pay requirements for the expanded paid sick leave. Paid sick leave must be paid at the employee's regular rate of pay or minimum wage, whichever is greater, for leave taken for reasons 1 through 3. So I'll go back. That's that they're subject to local quarantine, that they've been advised to stay home, or they are experiencing symptoms. An employee taking leave for the other 3 reasons can be compensated at 2/3 of their regular rate of pay or at minimum wage, whichever one is greater. Now, we get this question a lot. Can we require the employee to utilize other paid leave that is available before they take the emergency paid sick leave? The answer to that is no. The law specifically states that you cannot require an employee to use other paid leave first. So if you have made that requirement of your employees, we recommend that you reimburse their sick account, their PTO account, and instead deduct those hours from the emergency paid sick leave. So we get a lot of questions about the emergency paid sick leave. So let's take a look at some answers to some frequent questions regarding this. First, sick time only applies to individuals who are sick or who fall into one of the 6 criteria. We already went over those, so I'm not going to go through those again right now. If somebody does not want to come to work because they are afraid of a COVID infection, but they are otherwise healthy and not at a high risk, they do not qualify for paid sick leave. That's very important to remember. We have a lot of hospitals right now with people who are saying, I don't want to come to work right now because I'm afraid that me or a family member is going to be exposed to COVID. You can say, that's fine. You can take unpaid leave time. You do not have to pay people who are choosing to not come to work if they are otherwise healthy and not at a high risk. Now, if an employee lives with somebody who is a high risk, this could be considered a qualifying reason if that high risk individual is told by their doctor that you or your employee should not come to work. Now, again, this leave is for full-time, part-time, and exempt employees. You can prorate the time for part-timers, and you can average out daily production for production-only employees. So if one of your doctors averages $500 a day in production, then you can give them $500 per day in paid sick leave. For salaried or base pay employees, you're going to want to pay them the equivalent of 1 day of their salary for each day they are out. And then keep in mind, again, this time starts on April 1st, so yesterday. That means anyone who took time off in March or February for COVID reasons is not eligible. As I said earlier, there was speculation that the CARES Act would retroactive this, but they ended up taking that language out of the final bill. However, this can complicate things a little bit, because if somebody took time off in March, let's say, unpaid time off in March to take care of a family member, they can take paid time off in April or May or June in order to take care of themselves if they become infected with the virus. So even if they took time off before, if it was not paid, or even if it was paid, you still have to provide them with the paid leave now that April 1st has come around. So tax credits. This is probably one of the most important topics to most of us. How on earth am I going to have the money to pay for all of these people out on sick leave? Our understanding is that the tax credits are going to amount to a one-to-one reimbursement for the employer for the dollar amount paid to employees through both the emergency FMLA and the expanded paid sick leave. As of right now, it appears that this tax credit is going to be paid out in the form of refundable credits for your Social Security component of payroll taxes. This is going to be subject to both daily and aggregate caps, and so you're going to want to talk to your accountant or your iVET360 analyst for more information about what those caps are. The tax credits are going to be refundable. So that means that if you pay too much, the government is going to cut you a check as a refund. Health insurance costs are included in these tax credits. We've received that question a lot. So benefits such as health insurance costs, dental insurance costs, those are going to be included as money paid to your employees during their sick time. The IRS has stated that these credits can be applied towards federal income tax payments, Social Security payments, and more. However, the only one that we have confirmation about is the Social Security tax payments. So again, this is a very important one to talk to your accountant or your iVET360 analyst or your payroll company about to make sure that you are processing this correctly. We are highly recommending that you assign somebody in your practice, preferably a practice manager or even another doctor in the hospital, to specifically track any money paid to employees through the EFMLA and the EPSL. This is really important because you want to make sure that everything is well documented, not only to make sure that you get the money that you should get, but also so you have it handy in case of an audit. Right now, we have no idea what the enforcement is going to be looking like for this, so we want to make sure that you have all of your documentation in order just in case they decide to do a clean sweep and do an audit of all businesses that have claimed EPSL or EFMLA tax credits. So now let's head into the CARES Act. The FFCRA, the CARES Act, sorry about that typo, was signed into law by President Trump on March 27th. It is a comprehensive relief bill aimed at softening the fallout of COVID-19 on businesses and families. So these are benefits that are going to be for individuals, employees, employers, large businesses, small businesses, aviation industry. There are very few people in this country who will not be affected by this law in some way. One of the key features of the CARES Act is the Enhanced Small Business Association Loan Program. This is in part through the Paycheck Protection Plan that is a part of the CARES Act. These loans will be accessible through your bank, and can be for up to $10 million per business. Now, much of these loans are going to be forgivable. The stipulations are going to include the practice paying employees at normal levels for at least 8 weeks after the loan originates. Now, if you laid off employees prior to getting the loan, then you will still qualify. So if you've already laid off employees, but you hire them back before you sign the loan paperwork, you'll still qualify for that loan forgiveness. Hospitals can begin applying for these loans on April 3rd. Banks are anticipating that there's going to be quite a backup for these, so don't be surprised if the websites aren't working properly. You can go to the website that is on the screen there, the COVID-19 relief.sba.gov/#/, or you can fill out the application. Oh, that we didn't attach to this. But if you want the application that they currently have available, just send me an email after the presentation and I can send that out to you. The application process is anticipated to take well over 2 hours of time. Now, this is going to be a topic for our webinar on Tuesday when we're going to have a special guest iVET360 Analytics Manager sharing the most current information about this program. So if this is something that is of interest to you, make sure that you are on our Tuesday webinar. Now, there is also a large amount of money allocated for emergency grants to help businesses cover immediate operating expenses. These are not repayable, and they're meant to help cover expenses such as utilities, sick leave costs, etc. These grants are up to $10,000. You can go to this link right here, the COVID-19 relief.sba.gov/#/ to start the application. And then finally, the SBA is offering relief for up to 6 months of loan payments to hospitals that have already taken out an SBA loan. We've gotten a lot of questions about, well, I already took out an SBA loan. I don't know if I'm going to qualify for another one. What happens to me? In general, the SBA is saying that you can get 6 months of loan payment relief if you already have an SBA loan. So whoever your loan originator is, you're going to want to inquire with them to find out more information about how that's going to work. So now let's go over some best practices to protect your staff and your clients. Number one is taking employee temperatures, and we are going to go somewhat quickly through this because we covered this in our last conversation. We recommend considering, if you are thinking about taking employee temperatures when they arrive at the office, that you, number one, designate a person from the leadership team who is on shift for each day. Number two, make sure that the designated employee understands how to safely check a temperature, utilizing appropriate PPE for both the employee and the person taking the temperatures. Make sure that the temperature checker has the appropriate PPE and preferably an infrared digital thermometer. If all you have are oral thermometers, you might want to get your hands on one of those forehead thermometers that they use for babies. This is much safer for your team to use than having to reuse the same oral thermometer with the covers on them. Confidentiality is critical when we're talking about taking employee temperatures. To ensure that the whole staff feels like their privacy has been protected, we recommend having employees wait in their vehicle or line up, being mindful of social distancing, keeping them 6 feet apart, but well out of sight of clients. Some employees might feel a little bit embarrassed by having to do this. Even though they know it's necessary, it can still be difficult. They can still feel it's an infringement on their privacy. So the more you can keep this protected from clients or even from other employee views, the better it's going to be. So what if an employee actually comes to work and has a fever? You can send that person home on a 14-day quarantine. However, we recommend that you pay that employee for the day that they are in the practice to limit any legal ramifications, because some states say it's mandatory to pay employees for partial days. So you can check with your state laws regarding this. However, if you're placing them on the emergency paid sick leave, then you can just include that day as a part of that. Employers have to maintain all information about employee illness as a confidential medical record in compliance with the Americans with Disabilities Act and HIPAA regulations. Now, I keep hearing from a lot of practices, how on earth are we supposed to do that? This is kind of difficult, right? Because we've never been in a situation like this before where we're having to take employee temperatures when they walk through the door. And if you only have 10 employees and all 10 of them show up for work and you turn one away and then later say, everybody, somebody had a fever today, everyone's going to know who that is, right? All you can do is the best that you can do. Don't use names, don't point fingers, keep everybody focused on the mission moving forwards and make sure that everyone knows how to protect themselves. Now, keep in mind that up to 25% of people will exhibit no symptoms whatsoever, including fever. Taking a temperature does not guarantee that an infected person will not be in your practice. We call this something called security theater. So it makes people feel more comfortable. And if it doesn't hurt anything, then you might as well do it. If you feel like it's going to hurt things at your practice and you don't feel like anybody's going to feel any better as a result of taking temperatures, then you don't have to bother with it. Now, curbside service is another best practice that a lot of hospitals are turning to right now to limit the exposure of staff to clients and also limit the exposure of clients to your staff. So essentially what happens is a client pulls into your parking lot and they call the practice on their cell phone when they arrive at the hospital. A receptionist or a technician goes out to the car. With the client in the car, the employee stands outside of the vehicle, obtains a history, and then brings the patient into the practice. The doctor then calls the client on speakerphone during the exam to talk through the exam and talk about any recommendations that they have. When the exam and treatments are complete, the technician brings the patient back to the client and collects payment. Now, there are a lot of benefits to this and an awful lot of risks. So the benefits, number one, it limits the number of clients who come into your practice, which is good because it limits the number of people who your team has to be exposed to who might be carrying COVID-19. It also limits the direct contact between doctors and staff and clients. So it also protects your clients from anybody in your hospital who might be carrying the virus as well. And it also makes clients feel much more secure because they're not in a closed space with team members. Now, unfortunately, this comes with a lot of risks. The biggest ones are the risk of patients getting loose in the parking lot, increasing risk of injury. We have heard of this happening at hospitals all over the country. We've heard of cats getting out of carriers. We've heard of cats jumping out of owners' arms. We've heard of dogs getting loose and getting hit by cars in the parking lot. This is a huge, huge risk. There's also a risk of injury to team members going out to the car to get patients. A lot of clients aren't necessarily paying real close attention when they're driving. So it is possible if your team member is focused on getting to the car where the client is waiting and another client pulls into the parking lot and they can't see that car for whatever reason and the client doesn't see them, there's a possibility a team member can be hit by a car. There's also a possibility of them falling downstairs, getting their foot stuck in a pothole in the parking lot, et cetera, et cetera. So we have some recommendations to try to make this as safe as possible for everybody. Number one, make sure that your clients are fully aware of the protocol before they come to the practice. iVET360 marketing is sending out emails to clients to alert them to what the curbside protocols are for hospitals. Some clients are not going to be comfortable with this way of bringing their pet to the hospital, and that's fine. They can wait until the restrictions are lifted and then bring their pets in then. But you want to make sure that your team is very, very clearly articulating to clients what the procedure is going to be when the client arrives at the hospital. Number two, make sure that you have double or even triple leash protocols. We have heard of dogs getting out of double leashes. So we're recommending having dogs on a harness with a leash attached to it, plus a slip lead around their neck, plus possibly another slip lead around their neck or another slip lead around the harness. All small pets, so small dogs, cats, exotics, must be in carriers. If a client does not bring a carrier with them, because let's face it, a lot of clients with small dogs don't have carriers, then you can have your team members bring a carrier to the car, hand it through the window to the client, have the client close the doors and windows, put the patient into the carrier, and then hand the patient off to the employee. But you want to make sure to limit the risk of patients escaping as much as humanly possible. You're going to want to train teams to look out for all dangers in parking lots. A lot of times we're going to seem like we're saying some really basic stuff, right? We're going to seem like we're saying some things that maybe everyone should know about, but we cannot assume that everyone thinks the same way that we do. So make sure that you train your team on looking out for trip hazards in the parking lot. Make sure you train them on looking both ways before they cross the parking lot. Get everybody on the same page, and if possible, have them sign off that they were trained on these things just in case there's an accident, so they can't say, I didn't know I have to look both ways before I cross the parking lot. And then train the team on what to do if a patient gets loose. A lot of times when a patient runs away, the team stands there for a second looking at each other, not quite sure what to do. Everybody knows they need to figure out a way to get the patient back, but they don't know what to do that. So put together a protocol and train the team on what to do in case a patient gets loose. And then finally, train the team on how to explain the payment process to clients. This should be done on the phone prior to the client coming to your practice. Some clients are going to be concerned about handing off their credit card to somebody who's going to bring it into the hospital. So if you have mobile credit card machines, definitely use those. If you don't, make sure that you are telling clients before they arrive that if they pay by credit card, you're going to have to take the credit card from them and bring it into the hospital and bring them the receipt back. And if they're not comfortable with that, then they should bring cash or a check. A few final recommendations for curbside service. Number one, have a plan in place for emergencies and euthanasias. This has been something that a lot of clients across the country are struggling with. They don't want to leave their patient at the hospital for euthanasia, and they don't want to leave their patient who's suffering from an emergency at the front door. So those specific clients may need to be allowed in the practice. Emergency hospitals are going to struggle with this because a lot of the clients that you see have patients who are in really critical condition, and they're not going to be happy waiting out in their cars while you work on their patient inside. So you're going to want to talk to your team and talk to your doctors about how they want to handle this situation. And then create a protocol for personal protection equipment for in-hospital staff and for car runners. I've seen at hospitals when I'm driving around in my neighborhood here in Portland that a lot of the car runners that are going and getting patients from the cars aren't wearing masks or gloves. And they should be, because they are the ones who are directly talking to the clients. So make sure that there is a protocol in place for personal protection equipment for both your in-hospital staff, your doctors, and your car runners. So now for the time that you've all been waiting for, question and answer time. So I have been doing a lot of frequently asked questions throughout this whole thing. And like I said, I haven't been saying, here's the question and here's the answer, but instead I've been saying, here are some answers to some commonly asked questions. So this is going to be very similar to that. This way we can provide many more answers to questions as opposed to a, here's a question and here's a very long answer format. So question number one, when can team members come back to work? Team members who have been out due to confirmed or assumed COVID-19 infection should meet the following criteria before coming back to work. Number one, they need to be fever-free without medication for 72 hours. If somebody's been taking Tylenol for the last 3 days and then says, I don't have a fever, that doesn't count. They need to not be taking Tylenol for 3 days and not have a fever during that time. In addition, they need to be seeing a gradual reduction in all other symptoms over the last 72 hours. And then they also have to have had 7 days passed since the onset of symptoms. Now, these are the CDC recommendations. The CDC is saying do not allow people to come back to work until they meet these criteria. The problem is that there are doctors who are telling team members to come back to work within 2 or 3 days of symptoms onset. This is not okay. If a doctor releases an employee back to work before these 3 criteria are met, we at iVET360 are recommending asking those employees to stay home until they meet those criteria. In most cases, they're still going to have emergency paid sick leave left, so it is completely okay to ask them not to come back to the practice until these 3 criteria are met. And if they complain about it, you can say, look, this is for the safety of everybody else at the hospital and all of our clients. Next, layoffs, furloughs, reduction in forces, reinstatements, et cetera, et cetera. We're going to go through what each one of these means and how you can make the best decision. We're also going to talk a little bit about this on our webinar on Tuesday as well. So number one, a furlough. A furlough is considered an alternative to layoff. It requires you to reduce hours or have a specific amount of unpaid time off for employees. So for example, a full-time employee can be asked to only work 4 days per week instead of 5 days per week for a specified period of time. That reduction in hours is considered a furlough. Now, you can exclude people who are considered more essential. This can be a difficult decision for practice owners to make. And every day right now, you guys are having to make some of the hardest decisions you've had to make as a business owner, right? And so now you can also choose whether some of your employees are more or less essential. But let's face it, you are going to have some people who are less essential to operations than others. So, for example, your certified technicians, you might not want to furlough them, but maybe some of your receptionists, we might need to furlough them, or maybe your kennel attendants might need to be furloughed. It is okay to make those distinctions. Now, with a furlough, you must continue maintaining employee benefits. So even if you tell somebody, I need you to take the next 3 weeks off, you have to continue maintaining their benefits. The nice thing about a furlough is that most people who are furloughed should qualify for unemployment for the lost hours. So encourage them to apply for unemployment. In addition, and we're going to cover this in a few minutes here, some states have a Workshare program where the state pays partial unemployment. Now, you're going to want to check with your state's unemployment entity for more information. And like I said, we have a whole slide about Workshare programs in a couple of minutes. Now, a layoff is a temporary or permanent separation from payroll. Now, a layoff is a lot of times assumed to mean I'm getting rid of this employee for good, but that's not actually what a layoff truly is. Typically, with a true layoff, an employer believes that the conditions will eventually change and laid off employees will be able to return. The vast majority of layoffs that you're going to be doing in your practices are going to fit this description. All of us know that at some point, all of this is going to end and things will get back to normal, whatever normal looks like in a post-COVID world. Now, with a layoff, you have to follow all of your state and local final paycheck regulations. So that means in states like California and Oregon, when you lay somebody off, you have to hand them their final paycheck right then and there. In other states like Illinois, for example, you can wait until the next regularly scheduled paycheck time unless it's more than 5 days away. So make sure that if you have an iVET360 HR and training manager, that you discuss this with them to make sure that you are in full compliance with the laws. This is one thing that we like to really stress in our HR and training department because employees nowadays know more about their rights than employees at any other time in history. So if you let somebody go and you don't have their paycheck to them in the appropriate amount of time, they can actually file a claim with the state or US Department of Labor. So make sure that you're in legal compliance. Now, you can recall or reinstate people who were laid off, but you're not required to. So let's say you lay off 5 technicians, but once things get back to, quote, normal, you only need 4 of them back. You can choose not to reinstate certain technicians. However, we recommend that you are very careful to make sure that whoever you choose not to reinstate can't claim that you chose to not reinstate them because of some discriminatory factor, because they're a woman or because they're a minority or because they're over the age of 40, etc. Make sure that you have good reason for why you brought back some people and not other people. And then laid off employees are nearly always eligible for unemployment. Remember that unemployment is meant for people who were released from their job through no fault of their own. So if you terminate somebody for cause, then absolutely they are not eligible for unemployment. However, employees who were laid off because of the COVID crisis are nearly always going to be eligible for unemployment. And then finally, there's the reduction in force. Now, this is what a lot of us consider to be a layoff, where we let somebody go because we do not expect to ever need them again. A reduction in force creates a permanent cut in headcount. So this means if you currently have 5 technicians and you know that you do not need 5 technicians, you only need 4 technicians, and you're not ever going to replace that person unless you have some kind of a change in economic status at your practice, you let that one technician go permanently, you're not going to replace them. Now, a layoff can turn into a reduction in force if a hospital chooses to permanently not replace the position. Now, just like with layoffs, you have to follow all state and local final pay laws. And again, just like with layoffs, nearly all employees who are part of a reduction in force are going to be eligible for unemployment. Now, you don't always have to lay somebody off or furlough somebody. And a lot of times when situations like this happen, that's our first go-to. I have to get rid of people now to save my business. And in some cases, yes, that's going to be the right move. But in other cases, there might be a few things that you can do to reduce the number of people that you have to lay off, if any. So the first thing that we recommend is start off by asking if anyone wants to cut their own hours or take unpaid leave. Most hospitals have at least 1 or 2 employees who don't need the paycheck for whatever reason. They have a significant other who's got a really good paying job, or they're retired and they're on Social Security and they only want the discount, et cetera, et cetera. So you can say to your team, look, guys, we need to cut hours. I really don't want to lay anybody off. Is there anybody who's willing to volunteer to take an hours cut or take unpaid leave? A lot of times, this alone can reduce costs by a lot, depending on how many people choose to reduce their hours. Next, be really honest with your team. So if not many people choose to cut their own hours or take unpaid leave, have a meeting and tell them how many hours you need to cut. If you need to cut 250 hours this month, then tell them that. Say, I need to cut 250 hours this month. I do not want to lay anybody off. How can we make it so that we all share this burden together, and ask for their suggestions for solutions? During the recession, I did this with one of my teams, and I said, here's the situation. We need to cut this many hours. We can either all share the burden somehow, or I can lay off 3 people. And my team chose to have everybody take a pay cut and reduce their hours so that nobody had to lose their job. And I had some people volunteer for a larger pay cut or a larger reduction in hours so that people who were in a worse financial situation didn't have to suffer as much. A lot of our team members are going to be very willing to cooperate as much as possible, because whereas everyone definitely has self-interest, they also want to make sure that nobody else has to suffer. Now, we're getting a lot of questions about whether somebody can volunteer to be laid off. Now, technically, yes, but it has to be initiated by the practice owner or the practice manager asking for volunteers. So the right way of doing this is the manager says, team, we need to lay off 3 people for these reasons. If there's anyone who would like to volunteer, please come let me know. And then the employee says, I would like to volunteer to be laid off, please. This is completely acceptable because the manager or owner asked for volunteers to be laid off to avoid having to lay somebody off who's in a worse financial situation. The wrong way of doing this is for an employee to just walk into your office one day and say, I would like to be laid off, please. That does not count as a voluntary layoff. So I don't recommend allowing that to happen in your practice. If you have to lay somebody off, though, you can definitely ask for volunteers. Those individuals can apply for unemployment, and if they're in a better financial situation than some of your other team members, that can actually work out in everybody's favor. So next, how is unemployment working right now? The short answer is not very efficiently. The long answer kind of needs some context. So during the height of the recession from the early 2000s, at the very peak, approximately 625,000 people were applying for unemployment each week. Last week, 6.6 million people applied for unemployment. That is a colossal number of people applying for unemployment. As a result, sites are breaking down and processing is unbelievably slow. And it's because our systems were not built for this number of people applying for unemployment all at once. So we need to expect that everything that comes from the government is going to take longer than we're used to. So what can we do for our teams? Number one, your teams who you have to let go or you have to do furloughs for are going to complain about it. They're like, I can't apply for unemployment. Encourage them to keep trying. Tell them to log on every hour if they need to get onto that site. The site's probably going to break down once or twice while they're applying. It's okay. Tell them to re-log in and try again. Eventually, the unemployment departments are going to work through the backlog, and they're likely going to get back pay for the delay time. But that's it. Employers cannot help employees with unemployment claims. End of story. Also, if an employee gets sick after you've laid them off, you don't have to pay for the FFCRA time. Now, some employees might get more money while being unemployed. State unemployment, obviously, is something they're going to get. In addition, through the CARES Act, they're going to be getting an additional $600 per week in unemployment payments. And then they're also going to get an additional $1,200 per person in stimulus checks. This means that most people who you lay off are going to make more money not working than people who are currently employed. Our recommendation is just don't worry about it. It's really not something that you need to spend your time worrying about. These are unprecedented times, and so they are trying to do everything they can to keep the economy running as best possible. And so that's going to mean giving money to people who have lost their jobs. Individuals who have lost their jobs have probably lost their healthcare benefits, and so if they get sick, they're going to have to pay a lot of money to get care. So all of this is going to end up balancing out in the end. So if that's one of those things keeping you up at night, like, oh my gosh, my employees who I had to furlough are going to be making more money than the people who are working in my practice, just don't worry about it. And if one of your current team members complains that one of their ex-team members is making more money because they're not working, remind them of the fact that they lost all of their benefits, and so odds are they're not in as good a financial situation as we would like to think that they are. Excuse me, sorry. So Workshare programs. Most states offer a Workshare program. Now, hospitals have to apply for this and not the employee. This is something that is offered through states' unemployment offices. Usually the way that it works is the hospital must select 3 or more employees with reduced hours in order to participate. The hours have to be cut a certain amount. So for example, here in Oregon, hours for each person who's going to participate have to be cut a minimum of 20%, but no more than 40%. The employees that are chosen to participate in the program by the practice have to have worked for at least full-time hours for at least 6 months or part-time hours for at least 12 months before joining the Workshare program. You, as the employer, would make the weekly claims, and then they would receive partial unemployment payments to make up for the money that they're not making due to reduced hours. This can be a great way for you to cut hours in your hospital without laying anybody off and without having any financial impact for your team members. And it only requires a little bit of additional work on either your part or your practice manager's part. So if this sounds like something that might work for your practice, I would highly recommend that you contact your state unemployment office or just hop onto Google and say state's Workshare program. So whatever your state is, and then Workshare program, and that should direct you to the right place. A few final employee situations here. Number 1, if an employee tests positive for COVID, place them on the FFCRA sick leave immediately. They get up to 80 hours now that it is April. Let the team know that someone in the hospital has tested positive. Don't release their names. Everyone's going to know who it is. There's nothing you can do about that. But you cannot say Susie was diagnosed with COVID. You can just say someone in the hospital has tested positive. We are recommending that all employees seek medical attention for next steps. The CDC is recommending that any team member who worked closely with the individual be placed on leave as well. Now, in very small hospitals, this could mean that you might have to close your practice for 14 days. that's probably worth it so that the rest of your team does not get infected with the virus, because that could mean closing your practice for much, much longer later on. iVET360, wow, look at that typo. iVET360 also recommends sending an email to clients who have been in your practice in the last 2 weeks that they may have been exposed to an employee who tested positive, and recommend they seek medical attention. Now, again, it's important that you don't say, Dr. So-and-so has been diagnosed with COVID-19, and so you need to seek medical attention, but instead say, an employee that you may have come into contact with has been diagnosed with COVID-19. We recommend you seek medical attention. The only exception that we've seen to this is some practice owners are saying, I personally was diagnosed with COVID-19. You may have been exposed when I saw your patient the last time you were here. Pregnant employees, right now, there has been no additional guidance for pregnant women in the practice. So we recommend just following the Pregnancy Discrimination Act guidelines and treat them exactly the same as everyone else. Now, keep in mind that some pregnant women will want to protect themselves and their child and may ask to go on a leave of absence until after the baby is born or until after the virus crisis has subsided. We recommend allowing this and making it unpaid, as the mother has chosen to go on leave. However, if her doctor recommends that she go on leave, then she is eligible for the 80 hours of sick time through the FFCRA. And then for high-risk employees, employees with medical conditions, or employees who live with somebody with a medical condition should only be placed on leave if they have a doctor recommendation to do so. So again, if that person chooses not to come to work, you do not have to pay them FFCRA leave time or sick time. But if their doctor says you need to not go to work to protect either yourself or your family member, then they likely are eligible for the emergency paid sick leave. Employees who work with ER doctors, ER nurses, etc., should absolutely be allowed to come to work unless their significant other exhibits symptoms or tests positive for the virus. I've heard a lot of hospitals banning people who are married or living with emergency room technicians or emergency room doctors or nurses. And really, that's not fair to the families of the people who are doing their best to protect the public from this virus. So you can recommend that they wear masks or gloves at all times when they're in the hospital, but we should not say you cannot come to work just because you live with somebody who is working in an emergency room. As I mentioned, though, if that person's spouse or significant other, exhibits symptoms or tests positive, then you can ask them not to come to the practice. And then finally, I want to end with employee morale here. So let's face it, employee morale is probably pretty low in your practice right now. We cannot pay them anymore, but we can help to keep them engaged and focused on the mission of the practice. So I wanted to end with a few suggestions for you to keep your employees happy, because this is something that a lot of us are forgetting about with the COVID crisis right now. So first, be very honest and over-communicate. Employees appreciate honesty. They don't appreciate somebody saying everything's going to be fine 20 minutes before you lay somebody off. If things are going tough for your practice right now, tell them. They're going to want to do everything they can to help keep the practice afloat. Most of our employees really love the place that they work, and they love the people that they work with. And so the more honest you are with them, the happier they're going to be working to keep things going. In addition to that, over communicate. If you think you've said something twice, say it 5 more times. You're probably going to find yourself getting very annoyed with how much you have to repeat yourself over the coming weeks, but the more you over communicate, the more your employees are going to feel secure in their role in the hospital. Even if you have to lay somebody off, you can be honest with the team and say, look, we had to lay off 3 people, and here's why, and here's my plan to bring them back later. We also recommend that you review your mission statement and core behaviors routinely. You can even ask people to recite this and then throw them a candy bar if they get it right. You can ask the team what they've done to exemplify the mission statement and the core behaviors recently. I promise you, with the COVID crisis right now, your team's doing a lot of things that exemplify these pieces of your culture. We recommend discussing the hospital's why, and then also their personal why. Why are they choosing to come to work every day? Why are they choosing to work so hard? What motivates them to get out of bed in the morning? Create and recognize a recognition board. We recommend manager to employee, but peer-to-peer can also work right now as well. Keep it super positive and super fun. And then you can also try recognition apps. There are a lot of them out there. Bonusly is one of the most popular ones, but recognition apps allow you to provide recognition to employees, even if you think about it at 9 o'clock at night, right before you go to bed. You can hop on your cell phone, provide them with recognition, they get a little beep on their phone, which makes the serotonin release, which makes everybody happy. We also have seen question of the day boards utilized very well during this time. So you can make it fun, like quarantine theme. Once the restrictions are lifted, what is the first place you'll go? Or what coffee shop are you missing the most right now? Or what is the first restaurant you're going to go to when the restrictions are lifted? You can also create a hospital quarantine theme. What have we changed in the hospital that you want to continue when restrictions are lifted? There's probably some changes that your team members are liking right now, believe it or not. What has made you want to come to work each morning recently? Or fun and goofy questions. We do this at iVET360 every week. We've got a question of the week. So we'll have pet photo contests, or we'll have what was your first car, or what is your favorite food? Just goofy questions for people to get to know each other. So that is our webinar for this week. I know that we ended up lasting barely over an hour here, so thank you to everybody who has stuck with us. Kamisha Chronic, who's been answering questions today, will be leading next week's webinar, which is going to include information about the CARES Act, any updates to processes related to the FFCRA, and she's also going to be discussing compassion fatigue, which is something that we as an industry really need to start focusing on, especially for the practice owners and practice managers who, quite frankly, have the world and the practice and pretty much the health of everyone in their practice on their shoulders. We're still going to be answering as many questions as possible that we did not get to today. And then we're also going to have an iVET360 analyst on as well, talking about the SBA loans and some other financial information that has to do with the CARES Act. Now, we have recorded this webinar. The recording and the slides will be available at covid19.ivet360.com starting tomorrow morning. And if you have any more questions, you can also sign up for our HR COVID support, which offers you unlimited access to the HR team for questions and answers about your COVID response. Visit ivet360.com/HR/ to sign up or get more information about that. Otherwise, just keep hanging in there. Our industry is really providing an important and even critical service to our communities. We at iVET360 genuinely appreciate everything that you and your teams are doing to keep your practice doors open and your team members employed. You might feel alone right now, but you're in really good company. We are all in this together, so just hang in there and we will get to the end of this soon. Thanks so much for joining us today, and we will hopefully see you on Tuesday.